Hello, all my viewers. This is Terry the Aran. Yeah, today I just want to talk about diabetes and how does one get diabetes. When the pancreas does not produce enough insulin in your body, you get diabetes. Or when your body cannot utilize the insulin effectively, you get diabetes. So when you have diabetes, it means sugar levels in your blood are high. So how do you diagnose diabetes? What are the signs and symptoms that will tell you if I need to see a doctor? So if you realize these signs and symptoms that I'm going to mention, go see a doctor. Excessive micturition, especially at night. You pee a lot of times, especially at night. Number 2, excessive thirst. Every time you're thirsty, you want to take a lot of water every time. Number 3, you get hungry every time you want to eat, Number 3, some people lose weight. You eat well, but you lose weight. You cannot explain why you are losing weight. You need to see a doctor for further investigation. Some people get blurry vision when sugars are very high. You can't see clearly, you have blurry vision. It's a sign of diabetes. Some people get weak, they feel lethargic, they don't want to work, they just want to sleep, they feel lazy. Yeah, if you have all those signs, just go and see your doctor. Your doctor will do investigations so that we know what is the problem. If you find, your doctor will do a test we call HbA1c. That test shows the control of your sugars for the last 3 months, and this will direct the doctor to know if you're diabetic or not. So if you're diabetic, you'll be started on a treatment. So depending on the level of sugars, the doctor will decide on which treatment he will or she will start you on. And then the most important thing will be again diet. Now you have to switch to taking a diabetic diet, not the normal diet. You have to say bye-bye to sugars, most of the starch. You will have to really reduce on your starch and sugar intake. There will be no more feasting every time. Yeah, so you have to just, in most of our supermarkets, we have diabetic area. When you go, you shop for diabetic, you get diabetic rice, diabetic soda, you can take sodas, but diabetic. Okay, so we have to take care of ourselves. We know that if you have diabetes and you do not treat, you can go into coma. If sugars go very high, you can go into coma. And it can lead to other complications like kidney injury. Most of the patients who go in for dialysis are diabetic. So if you diagnose early by just ensuring that you're keen on yourself, you understand yourself better. If you feel like something is unusual, go for checkup, don't wait. Yeah, don't be scared of being told that you have this, because the earlier you know, the better. So many people walk with their insulins in their pockets. Nowadays we have insulin pens which are pocket friendly. in terms of cost and also convenience. You can put in your pocket and nobody will know you're diabetic. So when it's your time to get a jab, you give yourself a jab, you take your meal comfortably. So it's manageable if you diagnose early and you treat early. So let's be careful about ourselves. Let's take care of ourselves. If you feel like you are gaining more weight and your feeding habits are good, just take a test. If you feel excessive hunger, excessive thirst, you pee every time you're in the washroom, peeing every time at night like 6 times, just be worried. Just get worried, go see a doctor, get to be tested so that you get help as early as possible before we go into the complications where you can even get to start dialysis sessions, which are very expensive and time consuming. We better take care of ourselves, okay? So as I said, in this channel we talk about health matters. If you have a question, ask on this channel. I will get somebody to respond to you, a consultant. If I can respond, I will respond, because with my years of experience, I can give you very good advice just to ensure that you are on the right direction. So my name is Terry, and my channel name is Terry the RN and Kids. Please follow us, go to our channel, subscribe, like and share, watch our videos to understand more on health matters. We will be very glad to ensure that we have a healthy nation, a nation of people who understand their selves, their conditions, and are managing well, so that we can continue with our daily routine. We can go to work, we can go to church, we can go to party, because we understand ourselves and we know how to manage our conditions. So today it was about diabetes, and if you have any questions, just ask so that we can learn more together. Okay, for now I'll say bye bye.